Oh my God. Well, Camille, then you are very lucky. Judging from how people, now that people are starting to talk about opening up and everybody's like going crazy, then I would say most people are pretty ready to like move on in some way or another. But I do think there is something very nice about not having to not consume things, on all levels is a very useful thing. So, all right. So does anybody have any comments, questions, whatever? Please do.
Can I have a go?
Yes, of course.
I was just catching up with the last week's video, and you were talking about COVID things and again, whatever. But then, there's statistics that with these things, so much more in men's case, the suffering. So in terms of treating, anything, like, if it's something that, well, obviously not like a female, fertility issues and things like that. Is there anything that we should be more mindful about, or because this is a female thing or man thing, apart from, just an obvious man and a woman problem? Because I just thought that is a strange thing, just virus, affect man more.
Well, I obviously don't have an answer to that. I think it's such a new phenomenon. No, there's a few things that I think for us to remember constantly, that this is a 4-month-old phenomenon. I mean, it's probably longer than 4 months. Some people say it may be 8 months, but the point is it's very new, and we all want to have answers, and there's no way we're going to know the answers. So we can speculate. I think that generally, I think the statistics, yes, it is supposed to affect men more, but the other thing is what they're not showing, what I haven't seen, maybe they are showing it, is the different conditions and stuff, what else is going on. So I think, as we all know as acupuncturists, because, for most of us, the majority of our patients are women, which suggests that men don't take care of themselves as well. So it's possible. Now, is the virus attracted to testosterone? Maybe. I mean, I don't know.
Maybe.
No, I mean, there is a possibility.
Can I suggest something?
Yeah.
To what was that word? Sorry?
Testosterone?
Oh, testosterone, right.
Yes. Go ahead, Carmela.
There's something very interesting that I just yesterday was Zooming and listening. It's something, they're saying that the virus gets through the ACE2, right? Everybody probably heard about this, angiotensin pathway. And then it's a very interesting concept there about how to use zinc, quercetin, and Q10 combination and through food, because some of you know that I have a lot of interest in food. And so, but what you can do is you can Google. So the point was why kids, so not the men, why kids are getting less the problem than as we age. And the reason they say it's because they have less of the S2, and as we age, we have more of this. So the question is, maybe men have more of the S2? I don't know, but it's something to maybe this is the direction to think. So the more, because we have it, so we are much more prone. So the virus basically, their doorway, they knock on the door and they go through this channel, and then they start to develop and replicate themselves. And the question was why the French are using some combination of the malaria medication with some antibiotic medication and zinc. And the reason they're using the zinc, it's because it's slowing down the replicator. So basically, virus get through the S2 into the cell. Then the body look at this, look at the virus and say, okay, it's time to replicate, and start going crazy on replicating the virus. And what they're saying is that the zinc slows down the replication. But now, how do you get the zinc into the cell? It's when you have quercetin and Q10, they are helping to open the door for the zinc to get in, and the malaria medication does basically the same. So this combination is helping the zinc to get into the channel. So this is something that I like to share that I just learned about. And so maybe this answer the question, why more men? Maybe they have more of it, more of the S2.
Can I chip in for a sec?
Yes.
Yes?
Yes, I think, first of all, it's very common for diseases to be affecting men different from women. If you look at research on medicines as well, it's mostly done on young men, and slowly, gender differences are coming to light. But they're definitely there, they're just not studied very well. And I think that's just a very sexist way that medicine is. There's just a strong bias towards men being studied more. You know, of course, heart attacks, for example, heart problems are severely underdiagnosed in women, as they're often diagnosed as stomach trouble. And there's other like thyroid things appear much more in women than in men, and there's many more. And I think it's just not diagnosed enough. One. Second of all, I think there's one of the things that nobody wants to talk about is there seems to be quite a strong correlation between risk for corona death and use of hypertension, certain kind of hypertension medications and antibiotic use. And you know, it's not impossible that men would use one of those differently or in different amounts or different kinds than women. Of course, this would imply that it's not just a virus, but there's a human factor contributing to the disease. Third of all, I know for other infectious disease like the flu, it's been studied that, you know, it's not a virus that does anything. The virus is just there. It's your immune system responding that gives a certain reaction. And for flu, and my understanding is that women get a lower grade of flu than men. So in men, the temperature spikes much higher and much quicker than in females, which could actually mean that the suffering, so the acute suffering from men from flu is stronger than women. You know, they talk about the men flu, and usually it's meant to imply that yes, but if it's true that men get a higher temperature quicker, they may actually feel worse because their immune system is more strongly agitating. And of course, you can think of an evolutionary reason, like men maybe want to take the risk of a strong immune response, after which they'll be able to defend physically, and for women, perhaps because of you know, children or childbirth or pregnancy, or just because they're more valuable to the society, they have a lower temperature and a little bit longer kind of disease pattern, possibly. That's it.
Well, men also have more yang energy. So bringing it back to Chinese medicine, they may be spiking fever higher because their body temperature, you know, is more yang to begin with. It's just a thought. There's not a study on it.
Oh, bummer. We should get to Johns Hopkins immediately. It's interesting that we're, you know, given who we are, that it's all, you know, we have this great interest in all these things, and that, you know, the truth is we don't know. And I think that, whoops.
Sorry. Sorry, I didn't mean to do that.
Okay.
Sorry.
No worries. So I think that, you know, sometimes to watch ourselves and to see, like, the mind is very inquisitive, but to ask myself, you know, does it help me? You know, like how does it help me, this knowledge or this speculation on male versus female, etc.? Because right now it doesn't, primarily because I'm not treating. You know, so it's an interesting, you know, quite, you know, it's just interesting to wonder about it, but it isn't necessarily. I don't know if it's helping. I think it almost. I wonder if it sows more confusion, because there's so much confusion right now. So you know, it's in the same way that people are constantly trying to figure out how to best treat COVID when we're not treating. You know, it's like, well, you know, it's like when we start treating, we'll actually look at the clinical possibilities of it. Now, it doesn't mean that we shouldn't contemplate, but it just to observe like how much angst there is around this, you know, which is just that we have a lot of angst in general. So anyway, so I just thought I'd say that. Anyone else with anything else?
Could I come in there perhaps?
Yes, you can, of course.
I do muscle testing
Mm-hmm.
for 30 years now. So I asked my patients' bodies, what do they need?
Mm-hmm.
And when we had the swine flu, I went to one person's home and she had it quite badly. And I asked, what do they need? And what came up was this treatment that I do every second point on CV for infections, actually, which I've never seen before, but the body said, do this. It actually said do it with Korean hand therapy, which is the same thing as doing it virtually. So I treated that, and I went home and I had symptoms of swine flu. So I did the same treatment on myself, and it went within an hour. She also got better. Then, since then, I've been muscle testing. What should I do? What's the best treatment for me to do with COVID-19 for men and women? And the answer I get is the same. Men or women need the same treatment. And that's why I looked at the share screen, because I'm teaching this method at the moment in the UK. You know about 5 elements, do you? Going around the circle from wood to fire to all the way around the circle. You're okay with that?
Yes, go ahead.
Yeah. Okay. Sorry. Well, what I've discovered through my muscle testing is there's a 6th element, and that 6th element is in the middle of the circle. You know, the Shen is going round this way. It's right in the middle, and that one I call CVGV. CVGV. Right in the middle. In fact, it's got another name. It's even deeper than CVGV. And this is the deepest treatment I have found yet with acupuncture. This one it actually surfaces around the navel, which was shall I share the screen? That's what I was looking for. This picture that might describe it a bit more.
Yeah,
Do you want me to do that?
Go ahead.
Because I think since I discovered this a few years ago, I've had people saying, wow, that's a hell of a treatment, you know, and yet it's so simple to do. That's what I've been just, oh, here we are. Here it is. I'll just find it for you. There. So if I get an annotation up. That's the 5 elements. The Koreans nowadays put wood at the top, not fire, like I was taught 30 years ago. Then this is the one I've discovered in the middle here. And when you look at it, it's about that far away from the belly button. And this is why it's important to put wood at the top nowadays, I find. And then I found that the way to treat it is to use oblique needles going round in one direction or the other. Quite shallow needling, only half a sun or so. And it seems like you're not doing anything, but actually you're accessing all of the elements, including this deep one here. And you could go anti-clockwise as in this, or you could go clockwise. You have to muscle test to see where you start. You might have to start at the top, you might have to start on lung, or metal rather, and which way round you go. So that's a very simple test to do. I just offer it to you as a method that I found and muscle tested, that this will treat the deepest level with an infection as well, with COVID. So that's my 2 penny worth.
Thank you.
I can comment, Avi, that this is actually, and tell me, you're the master in this one. Actually, it's a very similar treatment that I learned from Kiko for allergies. This is true, Avi.
Yeah, it's similar in a sense, but yeah, allergies, because the nose and the navel related, and because the navel is where your original immunity comes in through the umbilical cord.
Again, please.
Your original immunity comes in through the umbilical cord. The first stimulation of the immune system is through the pulsation of the umbilical cord. And because for many people, the cord is being cut before all the pulsation is done, their immunity is not as complete. So yeah, needling around the navel for both of these reasons, because the navel and the nose are related as being, holographically in the center of different places, granted, but the way you're needling it is really sort of in and under towards the navel. So yeah, that is a treatment for sinus allergies. And, there's a lot that can be said around, this whole business of the navel. It gets, so Ren 8 is called Shen Shui, which is like the watchtower of the Shen. You have another Chui, Ren 14. Those are the only 2 watchtowers that exist in the body, as far as I know. So, there's a lot that can be said around, the navel is basically your original, it is going to be your core in some respects, no matter what, however else you think about it. Like, I can talk about the perineal floor or whatever, but, your connection, your life comes from the navel, in uterus. There's just no way to argue that. So, I mean, nobody has been born without, an umbilical cord. It's embryologically not possible within nature. Maybe it's possible in the lab, but that is our connection. That's why kidney 16, for example, is called Huang Shu, the shu of that which is dead in the body, meaning the ancestors. Okay, because that is your connection to your ancestors is first, not metaphorically, but physically, comes in at the navel. Kidney 16. Then you have other Huang points, bladder 43, you have outside the Sanjiao Shu, you have bladder 53, so you have more Huangs. But, the ancestors physically connect, first of all, through the navel. So your core, let's say, whatever you might define that, will be there. So anyway, yeah, these are all interesting things, well, to some extent, these are all interesting speculations, especially for those of us who don't do the same styles. But it's also very interesting to see what happens when you have patients, and at some point we will have patients. And what do we do with it? Like, then it's one more thing to be interested to try. And I did have a question for you with that respect. So this treatment of the Ren, which you apparently prefer to do with hand needles, I'm not so sure many of us would be all that interested in the hand, because it's a little more painful. But this skipping every other point, this treatment is you know, is it just something you have in your repertoire, and when you muscle test, you ask, and if it says, oh, do Ren every 2 points, you do, or is it a treatment that you originally figured out that it's good for infections or something like that? I'm just curious.
It's a treatment that first came up for me with a chap who was full of phlegm, and he couldn't feel any nail points, even with an 1.5 inch needle and hard needling.
Okay.
So with him, I actually did every single Ren point from one right up to the top.
Uh-huh.
Every single one. And I've got a photo of that.
Okay.
So then I realized that actually, like I was trained, you mustn't do more than 2 or 3 because it's too strong. Well, the body's asking for this, so I do it. Then after that, I tended to do it on a lot of patients over the years, but I tended to do it every couple of points because I found that was enough. It was only with that chap that I had to do it every point. So it's one of my standard treatments now that I do for all things, not just infection. But for the swine flu, it came up for infection, and since I've been looking at it, it's well, I do it not just for infection. These deep treatments around the navel, do it for spiritual reasons. I think almost anything really, because it's so deep. I think, you know, the deeper you treat, the more things you catch. Oh, that way around, isn't it? The more things you catch. Like, we don't treat on the surface, we treat down here somewhere. And this is treating somewhere down here.
Gotcha. Thank you.
Can I ask something, if we are staying on the navel?
Mm-hmm.
Can you say a few words, Avi, about when it's very pulsating, how to release it? And he's not always release himself. So the question is, with what David is doing, it sounds very, very interesting. But if it's very pulsating, I found if I try to put the needle, it's a little bit more sensitive for the client. So the question, if it's something that if we use this concept, David, which sounds very interesting and making sense, and in a few seconds I will tell you, because I do muscle testing a lot. So how do you release the navel, actually?
So I release the navel first. So pulsing in the navel is generally indication of 2 things. Now it's a very big subject, this pulsing in the navel. I can get into it in a second, but the dogma is this: it's either when the heart cannot contain the emotions, then the pulsation happens, because again, remember that Ren 8 is called Shen Shui, so it's the guard, the watchtower, the guardian of the Shen, but also because the blood contains the emotions. Okay, the emotions reside in the blood. So when the heart is unwilling, for example, you have an emotion that you know, I don't have this kind of emotion, me, no, you know, then it can show as a pulse around the navel. But much more typical is when the mesentery tissue itself is weak. It's an actual physical manifestation, because the pulse that you feel around the navel, you know, there should be, you know, most people have a good 5 cun between the front of the spine and their belly, even if they're thin. Okay, so the mesentery tissue, the small intestine, should really mask the aortic pulse. It shouldn't be there. Okay, if you're feeling it, it means that the dantian is that the abdomen is weak. So now originally we used to say that right side stomach 24 releases Ren 9. Okay, because we talk about Ren 9 as opposed to Ren 8. But you know, this pulsing around the navel is all around the navel. It can go all the way up to Ren 15 even. You know, that's exaggerated, but it can. Ren 12 is not unusual. But I don't find that that's really work, that right stomach 24 is called the slippery flesh gate, Wayomen. And so, you know, slippery flesh gate for that slipperiness in Ren 9. But I don't find that really works very well. Plus it's too close for my taste. Just like you're saying, when people have pulsation around the navel, you don't want to needle it. What I find works best is kidney points, because it is a weakness in the dantian.
Right.
And then side gallbladder 27, 28, mushu. So take Ren 4, go all the way to the side. It's in the
You'll be what again? You'll be weak?
Gallbladder.
Gallbladder.
26, 27, 28. Sorry, gallbladder 27, 28, which is take Ren 4, go all the way to the side below gallbladder 26. It will be in the tensor fascia lata. No, sorry, in the glute medius, not tensor fascia lata. And it's under the iliac crest, below the iliac crest, and you'll find a gummy point. That should release the navel pulsing to some extent. Nothing, in my experience, releases it 100% immediately. That doesn't exist. I don't have a point that I can tell you, you know, oh, use kidney 9 or use kidney 7 and the pulsing is gone. No, that doesn't, that honestly doesn't exist. Then add inner yin to that. Okay?
And add what to that?
Inner yin.
Inner yin.
Yes.
Okay.
To that. To create a better holding of the perineal floor. Okay.
So, Avi, basically, when you are wanting to look for the gummy point on the iliac crest, you put them on the side, right? You must turn them a little bit.
No.
Huh?
Totally face up, because you want both. You're trying to squeeze and elongate them. Okay, so you can't do one. You shouldn't. In my book, I never do this point one-sided. It's impossible, because if you do it one-sided, they go crooked. You want to. It's like squeezing from the.
You want to do the two sides of the gallbladder 27, 28.
Yeah. So they're face up, and the glute med. Look at gallbladder. You don't do gallbladder 26 lying on the side. You can do it face up, no problem. So you can do this
right
just below it. It's the same. It's not like I'm talking about gallbladder 25, which is in the back. I'm talking about gallbladder 26, which is totally on the side. So it's totally available to you when the patient's lying flat face up.
Okay.
There's no reason to put them sideways. Absolutely no.
Okay.
If you talk about gallbladder 29, the trochanter point, yes, then it's a little bit more exposed, especially because you can manipulate the leg a little bit more. But I do gallbladder 29 also totally face up. I don't put people on the side for it. I don't like treating people on the side personally. The whole abdomen changes. The whole gravity is different. Plus, yeah, I mean, some people are comfortable in it, but most people are more comfortable face up with a bolster under their knees, or face down. I do people on the side when they can't lie face down. So after I do front, I put them on the side and do what I can on the back, which is never exactly the same as doing it face down. I really prefer face down. The only point that is useful sideways for me is bladder 52. Okay, is it 52? Yeah, bladder 52. Needling towards the spine, and that's really for a person who's very large. And again, the problem here is then you can only do one side at a time and then flip them over and do the other side. Because again, I prefer to be able to do bladder 52 both at the same time, support the waist so that the chest can open. But, you know, if somebody's very big, it's usually better to do that bladder 52 on the side. But otherwise, I generally avoid side treatments and do everything front and back rather than side. The question about the navel pulsing. So, okay, so, you know, 25 years ago, yeah, just about 25 years ago, you know, Oketsu was king. You know, everybody supposedly had left stomach 27 pressure pain. If you look at patients in the last easily 15 or even 20 years, actually, very few people have Oketsu. Okay, it's just not a common finding. So in the 90s, it was definitely a very common finding, and then it disappeared. And then you started having a lot more people with adrenal. And adrenal was king for a while, and then that sort of went away, and then Ren9 pulsing became king. Ren9 pulsing is something you find on huge numbers of people. And the next thing that's happening is what you're finding more and more is right side stomach 27. And before that, you started finding, instead, you were not finding adrenals so much anymore by the late 2000s, I would say, but you were finding kidney 2 pressure pain. So finding kidney 2 pressure pain, okay, as a signifier of adrenal. Kidney 2, well, it's the fire point of the kidney channel, but also kidney 2 is called Rangu. So they translate as blazing valley, but this character Gu can also be replacement for you, which means desires. Okay, so the blazing desires, when we desire too much, we burn our adrenals. Okay, so we keep pushing our heels, you know, because we're trying to get more, get more, get more, get more. Okay, and you know, so that, you know, our desires, our constant burning desires shows on kidney 2. Okay, therefore burning our adrenals. So, sorry, I lost my train of thought. So what we're seeing is that there's the constant shifting of what is predominant in the findings. Now, if somebody's very good with pulses, you know, they can probably say something along, you know, maybe along these lines or some different lines about pulses change, you know, which is why sometimes I think it's a little bit interesting that we're trying to study whatever it is, 21 pulses from ancient times, but they may not be so relevant because I don't know what people had 2,000 years ago versus what they have now. That pulse, you know, so it's hard to know what things signify. We have to work with what we have. So it brings up a lot of questions, you know, for me in terms of speculations again, as to what will the world look like, the palpation world, which is the world I'm in. What should I be? What might I expect things to look like in the next year or two, having gone through this transformation, you know, when everything has been upside down in this period, and how will that affect the psyche and the soma of people, you know, and show in their abdomens or in their necks or in their whatever. So that's a whole other kind of interesting thing. But, you know, Ren9 pulse is definitely a development. You know, like originally, nobody ever talked about Ren9 pulse. In the 90s, we talked about pressure pain on Ren9 as being a sadness reflex, but never about pulse. You know, and that came later. I mean, so you can see that, you know, people keep changing. So my assumption is that we will see different, you know, maybe not next month or next 2 months, but over the next year or two, we're going to start seeing different presentations of the body. Simply because the culture has changed, that the concerns, our health concerns, our mental concerns, everything is possibly changing for us. We don't know. I mean, you know, it's too young. It's too early. But anyway, so that was just about the Ren9 pulse.
Question. Do you think that what's happened over the years, and by the way, I agree completely about the future and that the kinds of things we'll be treating will change a lot. But do you think that some of the things you've seen in terms of the shifts of, well, we don't see Oketsu so much anymore, do you think that's just a trend, or that, you know, certain treatments go into vogue and we forget about other ones at certain times? Or do you really think people have intrinsically changed?
Wow, good question. I think both. I mean, I can tell you that, you know, there are treatments that I'm sometimes I think, hey, that used to be so popular. What the fuck happened? Where did this go? And then, so it's interesting. Hold on, I just need to make sure I'm okay. It just looked like I was muted, but nobody complained. So maybe it was, oh, finally he shut up. So I think, yeah, there is something about treatments come in vogue, and, you know, that there's obviously, you know, each one of us goes through our own psyche. And in terms of thinking, oh, you know, I like this treatment, I no longer like this treatment, blah, 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 that kind of thing. But no, so here's my explanation of this. Oketsu was very big in the 90s. By the way, just for clarity, when Kiko first came out with a whole Nagano, system, which I got piecemeal. It wasn't like there was a book. Okay, so Oketsu was one of the last things that came out of Nagano. From the Kiko perspective, I don't know what Nagano did in the 60s. Okay, I don't want to, but it wasn't like it was the first thing that came out of Kiko's mouth when she went and studied with Nagano. Okay, the first thing was like spleen 9 and immune points, and then it was the blood pressure treatment, stomach 13 for visceraptosis. There were a whole bunch, and the Shaoyang treatment. There were a whole bunch of other treatments that preceded the Oketsu thing. And then suddenly came 1996, maybe 1997, I'm not sure. I could look it up because it's in my notes. And suddenly Oketsu took over, and that was it. It was like Oketsu, 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 Oketsu. And there was this claim that 80% of people have Oketsu, and it was true. Okay. Now, was I looking for it? Probably. Now, we very rarely talk about right side stomach 27. So if you look at the 90s was an era of life was quote unquote good. The wall just fell, the economy was fabulous. If everybody remembers, it was the dot-com industry, everything was fabulous. We were all having a little bit too much cheese, too much wine, whatever. So it made sense that the blood was getting a little thicker. There was more stagnation, in TCM terms, there was more stagnation, but light stagnation, quote unquote. It wasn't the stagnation that comes with tremendous fear. It was the stagnation that comes from, you're just having a little too much good time, so the cheese and the wine are fermenting inside you kind of thing. So the blood is piling up. Then comes, and so first comes the Y2K business, which we sort of escaped. It actually never happened, but the economy sort of fell. And then came, I can only speak about the US, unfortunately, because I live here. So then came an election. This is the first time in history that we recall, although it did happen before, we had a president that was actually not elected become the president. George Bush did not win the 2000 election. Okay, but he won, but he got to be president because Al Gore decided not to challenge the Florida count. And we know that for sure George Bush did not win the electoral vote, which has happened in the past, but it wasn't as well publicized. So now you have an America that is a global power. I live in an empire in decline, but it's still an empire. Okay, so for you living in Britain, or influenced by Britain in some way, you can probably relate, even if it happened before your time, because it started, you can see it from the Dickens, times moving forward. That when an empire in decline slowly starts to understand, but it also influences the rest of the world still. Whatever happens in America does influence the rest of the world. Everybody's watching Hollywood. It's as if they want to or not, because that's what you have on TV. So it's yes, you're not Americans, but you are influenced by what the mentality here, unfortunately, or fortunately, I don't know, doesn't matter. So
yes, we're really very sorry for it.
Yeah, I mean, I am, but it's like it just is. So what happens is America is based on 3 principles, as I see it. I don't want to get too political about it, but Americans think that the economy is always going to win. We are very much capitalist. Our nature is very much about capitalism and economy. People came here to make better lives for themselves. It's just the nature of this country. So this unlimited growth has always been assumed in this country. And the second thing is, this country, we are promoting democracy. Now, people can laugh at this notion, but Americans really see themselves as promoting democracy, even when they don't. I mean, they walk into countries and invade them and do weird things, all in the name of democracy. But, right or wrong, it doesn't matter, but this is how we see ourselves. And the third thing is, we're safe. America has never been invaded since the British were here. And yes, there was a civil war, but, we got over it. And, and except for the Japanese bombardment in 1941, in which Hawaii was not part of the US at that time, by the way. we've never been attacked. So what we happened in 2000 is we had an election that kind of eroded our confidence in democracy, which, by the way, the 2016 election created even more of it. Okay. And we had a shakedown of our sense of stability. And of course, we've had economic downturns. So the three pillars of what makes America feel like life is normal and correct and whatever have been eroded since 2000 to the nth degree, constantly. So this is a constant phenomenon. So as a result, what you're seeing is, instead of like the too much wine and cheese, you're seeing a lot more fear. And then we've had this phenomenon. I mean, this has been going on through the 60s. I remember as a child, people talked about environmental impacts. You know, I remember recycling, you know, in the early 70s. You know, we used to save the tops of the yogurts, the aluminum things of the yogurt for recycling and stuff. We've known about depletion of resources and global warming and overpopulation, et cetera. We've known that we're not keeping the world well, but we have somehow ignored it, and we've basically blamed the systems. So we've basically come to a point where I, as an individual, cannot take action. So I kind of let go. I'm resigning. I feel helpless. And that, so from having an adrenal, like adrenals are, I'm going to knock this thing over, you know, the 9/11 or whatever. I have resources that I can deal with. It eventually becomes to, I can't do anything. And that's when you get the Ren 9 pulse. And the way I saw this very clearly was when I was teaching in Indonesia. I saw a lot more Ren 9 pulses about 7-8 years ago than I'd ever seen ever. I mean, there were already Ren 9 pulses, but you go to a third world country that was really, developing country that was, has been impoverished in the most incredible ways. I mean, it's a country that's been devastated by the Dutch, you know, and then the Japanese, of course, also. And the amount of poverty and you know, there's just so much desperation everywhere. And you see these Ren 9 pulses, and then after a few years, I saw that those disappeared, even in Indonesia, which means that there is even something stronger that takes over. And my thinking is that that something stronger is, and this I observed also in Indonesia, was people walk, like you just walk, see them on the street, and they're just like shuffling. There's no upward movement in them. So this is why I got so interested in this concept of chwai, of pushing down to lift up. Okay, this is the main thing that's lacking, because we're just not bothering. We're just in a culture that's become, we don't have control over our lives. You know, so we do what we can to accumulate what we can to whatever, you know, take care of our lives, be nice if we can, whatever. But, you know, so that's where I think these shifts come from. They reflect a global cultural shift in how we perceive ourselves as humans. And, you know, it's going to be very hard to know how that's going to happen once there's going to be incorporation of technology into our bodies, which is already happening, but it's going to be very strong at some point. You know, we're going to be partially robotic, possibly. I don't know. But it's definitely a possibility, because, you know, you're seeing it all the time. And with all sorts of weird gene therapies and all sorts of interesting things that are happening, the body will change. We're no longer as Yuval Noah Harari says, we're no longer going to be Homo sapiens. We are creating a new species. And we're sort of part of it still, and the generations after. So I think that they will look at what we're doing and they'll say, well, it doesn't apply, because these were primitive. This was a primitive form of biological form. We're no longer a purely biological form. We're a partially biological, partial, say, artificial intelligence form, whatever, I don't know. We're just at the very, very beginning of it. So we're still seeing cultural shifts, much more, you know, these shifts of wars or famines, or, you know, that would be the traditional Chinese things, or in our case, you know, the fears of pandemics and political shifts, etc. But so yes, I think that Oketsu disappeared because not because of a fashion, but because the human specimen, or whatever it's called, the human beings have changed. They're no longer the same human beings that they were in the 90s. Does that make sense?
Yes, thank you. That was very interesting.
Thank you.
Yeah, very much, because I'm doing it from the 19, and when I look back now, what you're saying, Avi, it's true that I'm surprised that I don't get oketsin, people who are talking about really pain, what we call blood stagnation. So then why I'm not finding them? And it's like, and in one of the seminar, I asked Kiko, but we both know her. She didn't give me this long explanation as you. So thank you so much. It's really nice. I figured it out, but I didn't understand why it happened. Why is happening? People with pain supposed to be having no cats, and it's not too much.
And what? I'm sorry.
Okay.
Can I have something, one more observation about the navel that I like to ask?
Yeah,
Can I
hold
ask
on one
now?
second. Hold on, Camille, because Camille had something to say, and then we'll get back to you. But go ahead.
It's fine. It was just a short comment that, it's what you discussed is not just helpful to look at the past, but also to anticipate trends in the future, not just from COVID, but it gives me a different perspective of looking at the more social aspects of what to be looking for in my treatments. And I don't think I ever brought that perspective. So thank you.
Yeah.
So hold on one second, Camilla. So two things I would say. Number one, on the oketsu level, oketsu is not the same as blood stagnation. It's you see what happens is people mix oketsu with a TCM concept. And it's not. Oketsu is the blood piling up. Okay, so the blood is getting thicker, and so it's not moving as smoothly. That's not quite the same. So blood stagnation in Chinese medicine we associate with pain because you're looking at herbs like taoren, honghua, sanling, those kinds of moyao, ruxiang, those kinds of things. That's different concept. Oketsu is related more to sluggishness, like people who've had a lot of infection. So, the question is going to be, okay, so here, because oketsu was discovered in TB sanatoriums, okay, infections, okay, and there was this big question. TB sanatoriums, they're supposed to show classically right side of the navel, because that's the lung. Why are they showing on the left side? And the answer was because of the inflammation, the infection, the blood gets a little bit slowed down. So you see how the concept is a little bit, is not 100% translatable between blood stagnation and oketsu. They are different. In terms of, Camille, what you said about looking at the future. So one of the things that I would say that is worth looking at, and it's theory, but I don't believe that things happen overnight. COVID-19 happened, we all got stuck at home, and now suddenly we all have different bodies. No, there was a trend constantly happening. And this magnifies a trend that was strong. Now, it may also erase a trend that was strong. I don't know. But if it is going to encourage a trend that's already happening, I would say what you're going to find is you're going to probably find a lot of lung 1, lung 2 area because of the the curving in, and you're going to find a lot of the inner border of the scapula. The circulatory issues are going to come up.
The what about? What kind
circulatory issues.
Circulatory. Okay.
Are going to come up, and that's my sense of it. But they are still related to the fact that the reason why the upper body is coming up is because if the people are not using their legs to push and create space in the abdomen and the chest, then the chest has to overwork, and the chest doesn't want to work. So, the chest is creating a lot of tension. So the chest is like trying to hold the person up. So it's about, can the legs support the chest? Can the chest relax and create easy circulation? Is my sense of what's likely to be one of the big components that we're going to see. but I don't know because it's too early. You know, it's like I'm not. First of all, I'm not seeing people right now, and secondly, it's too early. I mean, that's something in 5 years we'll go. Okay, yeah. I've speculated on what was it, May 4th, and look what bullshit. You know, whatever. So that's what I'm thinking. Now, there's also been a huge trend in the past, say 5-6 years, to go for scalp. To treat more and more scalp, meaning treating the brain as directly as possible and really letting go of the body, kind of bypassing the body. And again, that's a trend that has to do with the more robotic, quote unquote, we become, the more that's going to get strong. And the question is that going to stay that way, or is it actually going to be, will this phenomenon of COVID kind of push that away? And because suddenly we're, this is the first time in most of our lives that we're actually viscerally or physically feeling life or death, rather. We as a generation generally have not. Most generations haven't before us, have touched death much more clearly, constantly in our daily lives. We haven't. So, it'll be interesting if that pushes us back to a body orientation, or whether it continues the trend of going brain only. As long as the brain is happy, nobody cares. You can be obese and you can have diabetes and you can have high blood pressure, but your brain's working fabulously. You're very happy in your brain playing games, whatever. I'm making shit up. But but you know what I'm saying. I'm making a caricature in order to do that. So it'll be interesting to see which trends continue and which don't. But I think to say that COVID is going to start a whole new trend from nothing, I think it's going to pick up things that have already been fermenting. But anyway, Carmela, you had something you wanted to ask.
Yeah, back to the navel. I love the navel since like today. So, okay, so Ren9, you're releasing it with kidney, but I have another observation that I like to get your feedback. That when I go to the navel, and it's not always pulsation, it's sometimes really a pain. And so then I release it usually with the spleen meridian, which again, back to this concept of points changing, I think the disease of overly weight or changing a lot the diet. So not necessarily weight. I think it's a lot of confusion about what diet is right for me. So the 90s and after that, the industry of making money by understanding that this is a great way to go and make money by giving people different diet. One is the zone and the blood and this and that, are causing a lot of change in the metabolism of the intestines, which means flora is changing, allergies are building. I don't remember much as a child that people had peanut allergies or these allergies to food, and all of a sudden we see the very strong, and some of it is due to, they're saying about more pesticides in the food, and I don't have, and probably it's the reason. So when I go to the navel, a lot of the time I release them with spleen points. What is your point on this one?
It depends. Okay, so the navel officially is in the spleen category. So if you're looking, unlike David, who has in the middle, he has the Rendu. In the 5-element chart, the original 5-element chart, the center is the spleen. So therefore, navel is spleen, Ren 15 is the heart, Ren 4 is the kidney, the right side is the lung, and the left side is the liver. That's like that would be the Nanjing way of looking at the abdomen in general. So now the navel itself, if you look at what's behind the navel, primarily you're going to find the small intestine. So yes, it's going to correspond So if we say, in Chinese medicine, we generally say something like, I may have the wrong phrase here, it may not be exact, but there's a general sort of consensus that the energy of the small intestine and the large intestine come from the spleen. We generally tend to treat the spleen for small intestinal for digestion, even though in truth, if you think about it, small intestine should have been the big deal in Chinese medicine. Instead we created the spleen as the center. Okay, so yes, spleen 9 and the navel are highly correlated. There's no question about it. Possibly spleen 3, you could use other points on the spleen, but yeah, the spleen and the navel are clearly related. I would say, however, I think it's a little bit of a mistake, so I don't know if it's a mistake, but, there is a very strong shift towards treating the yin organs that has happened. I'm not exactly sure at what point, but it's, let's say, the last 300-400 years. Okay, so prior to the Dachang Dengjiu, prior to 1600, there was a much stronger emphasis on the fu and the yang channels. And nowadays we tend to emphasize the yin channels and the zang. So again, it's cultural shifts that have happened over time, presumably because diseases were different, people were different and stuff. But I would say that the small intestine channel is still worth looking at. So I have this understanding. So in the small intestine channel, you have small intestine 2, which has a qian, which means before, and you have a small intestine 3, which has a huo xi, qian gu and huo xi, meaning before and after. Okay, now you do have before and after in another place in the body, which is around do 20. You have before the vertex and after the vertex, do 19 and 21, which, by the way, might explain why the Chinese are so clear that small intestine 3 has to do with the do. Okay, but I think they're talking about the upper do. Okay, but this before and after has to do, I think, with the 3 sections of the small intestine. Okay, just like in the large intestine, you have large intestine 2 is called jian, and large intestine 3 is called sanjian, meaning that the second and third spaces. I think they're trying to say that the small intestine 1, 2, and 3 are related to the organ, possibly to different parts of the organ, because the small intestine also has, duodenum, jejunum, so it also has 3 parts. So, I would say try either. Okay, now, by the way, another way to check the navel, instead of checking points, with one finger, I mean, you have all 3 fingers, but you're really checking with one finger. In my case, it's the middle finger. Okay, I mean, some people could be a different finger, but you're checking really with one finger, supporting with the other 2. Press on the whole navel with a whole palm and see if they kind of go, don't like that. That's definitely a small intestine phenomenon. Okay? And then I would either try small intestine 1 and 2 together, or small intestine 3. Either 1 and 2 or 3. I don't do just 1, and I don't do just 2, and I don't do 3 and 1 or 3 and 2. So it's either metal water.
Small intestine and the spleen. First you release it with the spleen, and then you go to the small
intestine. Maybe or maybe not, depending.
Okay.
All I'm saying is, the spleen is one thing, and another thing is the small intestine, and both can be valid for the same patient.
Okay.
It's not like one or the other, or one first and then the other. But I'm just saying it's another option. I will say about the small intestine is that I will tend to do it. First of all, I will tend to do it just one side. Check which side works best. But if you do both sides, be aware that it may be different points. One side may be small intestine 3, another side may be small intestine 1 and 2. That they doesn't, just because you checked one side and it gave you good results, doesn't mean the second side will be exactly the same. It may be different.
So, but if the result happened, why do you need to go to the other side?
Because sometimes the result, okay.
If the result is not fully covered. You mean
number 1? Okay, so my method of work. you got it, but I'll
Okay.
also say something else. In my way of working, I don't do this thing where I find something and I test, and if it works, I needle. I test all the points that I think I want to test, and I needle at the end. And the reason why is because let's say you decide kidney 6 and 27, it seems to resolve the whole abdomen and you go for it. And then something got left. Because sometimes when you press on the point and then you needle it, it's not the same effect. So what happens is you did kidney 6 and 27, and now you're trying to scramble and find out what else will work. And that's not a good strategy. Why? Because now things are masked. You already have points in. So I like to test each point as much as I can, virginally, okay, without anything else influencing. So I know, okay, small intestine 3 does a great job for this point, this, it resolves these issues, okay? And I check each thought, each pattern that I'm trying to figure out if it's relevant to the patient. I test it on its own without the influence of other things. Then I start needling and add. And then, in that process, I'm saying, this point doesn't 3, it only releases the navel. Fuck it, it's not really worth it. At the end, because it's not releasing anything else. But at the end, when I did my strategy, and then I still have some pain on the navel, I go, oh, but small intestine 3 did a good job for it. Okay, I'll add it. But it allows me to prioritize by testing everything in advance. It allows me a better way of prioritizing as opposed to start and keep going. You start and keep going, it's hard to prioritize in my experience. Does that make sense?
Good point. Makes sense. So do you mind just to repeat the navel? The middle is the spleen, and then you say REN 12. I couldn't follow too fast. Above the navel, below the navel.
Oh, okay. So if you say roughly areas in the abdomen that reflect the organs, it will be like this. The navel, around the navel, is the spleen. Above the navel, REN 15, REN 14, 15 area is the heart.
Okay.
Below the navel, REN 4 is the kidney. On the right side is the lung, and on the left side is the liver.
Okay.
Are you okay, Gio?
Yes, I know. I thought that you were talking about something new that I didn't know. So no, thank you so much.
There's nothing new under the sun.
Okay. Maybe, each day people are working and I have a finding, and I
That's
think
true.
I can share right now the finding of disappearing of Oketse.
Yeah.
And maybe we'll come back because we will see. Honestly, I think the clients that we will be seeing is the time when we open, or in a year or two, will be people who had some COVID, or they had some, and then, but they're still having symptoms, so they are weak, or they are still coughing and the cough never goes away, or they've
It's possible. No one knows what the damage of physical COVID is. What we do know for sure is that COVID is definitely creating a psychological imprint on our generation. And what that will mean, it's very hard to know, because if you look at, say, what we like to compare to Spanish flu, it's very popular now. If you remember, yes, there was the Spanish flu, which came after World War, so it's very hard to say. And then there were the flappers. So everything was very happy and wonderful in the 20s for a while. So it's hard. It's very, very hard to know. And of course, we live in a very different world. The world of the 20s was a world where, nobody really considered anybody outside Europe as having any worth. Europe could think they could do whatever they wanted and imperialize whatever in the meantime. I mean, we can't quite do that in this world. What happens in Brazil, or what happens in Africa, or it all influences. Look what happens in China influences. In the 20s, China was nothing. China was just a place where you could just, get your tea from and to take whatever resources you wanted from. The world is not like that anymore. So we'll see. I don't know.
Okay. Thank you, Avi. Thank you so much.
You're most welcome. Anyone else before we end? All right, well, have a wonderful week. And those of you who are starting to consider opening, enjoy your plans and your considerations and whatever. Be, just be slow. It's okay that we still have a lifetime to go. We don't have to open in 1 week or in 1 month. There's lots of space.
Thank you.
All right, well, enjoy.
Yeah,
Thank you so much, Avi. Thank you.
Bye.
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 Bye.